guys! Welcome to Historical Gossip. In this channel, we do what humans have done best since we've evolved to be a super aware being. Gossiping! Today, we will delve into the fascinating world of historical medical tools and treatments, starting this video with a focus on early 20th century England. Join me as we explore the ingenious and often curious medical practices of the past. At the turn of the century, pediatricians recommended an unusual practice for babies. They had them wear a peculiar cap during sleep to prevent what was thought to be an undesirable trait: protruding ears. However, modern experts argue that the prominence of one's ears is largely determined by genetics and cartilage development, rendering any headgear ineffective in altering this outcome. For those who are already apprehensive about visiting the dentist, consider this historical contrast. In the 1500s, English physicians resorted to a relatively rudimentary device, a mouth dilator, to forcibly keep patients' mouths wide open during dental treatments, a stark departure from the advanced anesthetics available in modern dentistry today. Discoveries like these mole paws from early 20th century England reveal the intriguing world of amulets believed to possess curative powers against various health issues such as cramps, muscle aches, and even toothache. Advancing to the late 19th century, we encounter a fascinating device, an optometry apparatus. This invention, featuring 38 rotating lenses with varying strengths, was employed to ascertain the exact prescription lenses required for individual patients. In the sphere of medical instruction, an extraordinary wooden mannequin from 17th century Italy played a crucial role as an invaluable tool for depicting the intricate skeletal structure of the human body in anatomy lessons. Although these intriguing items may seem like regular glasses, they actually served as vessels for eyewash in 19th century England. They were utilised to treat conditions such as conjunctivitis, where warm water or other liquids were poured into them. Patients would then position their eyes against the container and tilt their heads back, ensuring a comprehensive rinsing process. A fashion accessory that would spark discussions if worn today. For the aristocratic women of Victorian England with sensitive ears, an elegant solution emerged: the black silk-covered hearing trumpet, a stylish hearing aid of its time. In a time when powdered milk didn't exist, the sole solution was to endure breastfeeding, even when it proved to be extremely painful. Intriguingly, early 20th century mothers in England had access to rudimentary nipple shields made from various materials such as glass, silver, tin, or ivory. These shields allowed them to breastfeed even when dealing with sore or painful breasts with milk flowing through small openings. Handling constipation in the 1800s was not an easy task. Patients would lie on their side and an attendant would administer warm water through a cannula in the rectal area, a far cry from modern remedy. A Roman bronze surgical knife resembling a scalpel from ancient times reminds us of the early days of surgery. It's interesting to note that back then many medical tools were made of bronze before steel became the standard. Explore the world of traditional Chinese medicine through a wooden model created for acupuncture training between 1601 and 1700. Acupuncture, a practice focused on improving the circulation of qi, the body's vital energy, involved the precise insertion of needles at specific points. This detailed model highlights the crucial acupuncture points and meridians, which are pathways for the flow of qi. As we journey back to England during the period from 1880 to 1920, we come across a rather unusual device, a metal bracelet designed for addressing nocturnal masturbation and discouraging self-pleasure. It was fastened around the penis and tightened using the locking screw overnight in a painful and distressing preventive measure. Today, we understand that masturbation do not harm and, in fact, may have health benefits, including potentially lowering the risk of prostate cancer. Now, let's take a look at France between 1715 and 1830, where we find a unique set of tools for the barber surgeon's kit. These tools weren't just for grooming. They allowed barbers to perform minor surgeries like tooth extractions, bloodletting, stitching wounds, and wound cleaning. In the early 20th century, there was an unusual-looking device used for electrotherapy in England. It might look like an elegant clock, but its job was to give patients somewhat uncomfortable electric shocks. Electrotherapy was believed to help with conditions like sciatica and headaches, but obviously using it at home was highly risky. Let's now take a step into the captivating world of phrenology, featuring a set of 60 phrenology tests from England dating back to 1831. Phrenology was a belief in the 19th century that claimed a person's personality and mental traits could be determined by examining the shape and size of certain areas of the brain. However, it's important to know that phrenology doesn't have a solid scientific foundation. Witness the evolution of medical transport with the Europa's ambulance model used from 1801 to 1850. Invented by Napoleon's chief surgeon, it earned the nickname flying artillery for its speed and agility. Unlike earlier ambulances, this innovative vehicle was designed specifically for transporting wounded individuals and incorporated features like shock absorbers and improved ventilation to enhance hygiene standards. It may seem strange, but this chair was used in the 18th century for childbirth. We have come a long way. Poliomyelitis, a frightening ordeal for our grandparents. Polio was a highly dangerous disease, and back then, the only way to save those affected was by placing them in these steel lungs, which took over functions their own lungs couldn't perform anymore, like compressing and breathing the surrounding air. Unfortunately, many people, millions in fact, became completely reliant on this life-saving machine. Nearly 100 years ago, it was a common belief that this bottle of radioactive water could cure any kind of illness. If it resulted ineffective, doctors would resort to using heroin. This device, which looks quite similar to a torture machine, was used in the late 19th century to help people with scoliosis. With the patient in this position, the doctor could assess the extent of damage caused to the spine by scoliosis. Lastly, we stumble upon an intriguing symbol, a wooden alligator model dating back to England roughly from 1801 to 1900. These alligators were frequently found hanging from the ceilings of pharmacies, serving as emblems of apothecaries who dealt in medical remedies, spices, fragrances, and medicinal herbs. During the Middle Ages, there was a belief that alligator teeth and scales held medicinal qualities, highlighting the fascinating convergence of folklore and medicine. This journey of medical history unveils some unusual and even crazy practices from the past. These artifacts are worthwhile reminders of how much medicine has evolved, leading to the advanced healthcare we have today. And you guys, have any of you ever embraced a traditional health remedy from the past, only to discover that it was rooted in outdated beliefs?